When we're talking about women going on hormone replacement therapy, how long do they need to be on hormone replacement therapy?
It's $1 million question, isn't
Hmm.
it? So you can be on hormone therapy for the rest of your life if you choose to. You will reap the benefit from hormone therapy for as long as you take it. When you stop hormone therapy, you will lose the benefit, right? You'll lose the benefit on your metabolic health. You'll lose the benefit on your bone health. You'll lose the benefit on your sleep, your stress management, et cetera. So you can take so I tell people, as long as you don't develop a contraindication, you can take hormone therapy for the rest of your life. But people get all up in arms and they keep tripping over this idea of the 10-year window. And that came from the WHI, this idea of the 10-year window, that if you initiate hormone therapy within 10 years of menopause, you can prevent cardiac disease, right, by about 30%. But if you initiate hormone therapy after 10 years, you probably don't have that same benefit. So this is where the 10-year window is. But people, make this a very staunch thing. And they say, well, you can't start hormone therapy after 10 years. Well, actually, you can start hormone therapy after 10 years with an appropriate conversation about risk. Or they say, then you have to stop hormone therapy after 10 years. No, we're talking about people starting hormone therapy after 10 years. So people get really confused about what that means. So all that means is that you will derive the best cardiac benefit from hormone therapy if initiated within 10 years. If you started after 10 years, you might not get the same cardiac benefit, but you certainly will get the benefit on your mental health, on your bones, on your metabolic parameters. There's still many benefits to be had after that 10-year window.
Yeah, with an appropriate risk assessment. I think
Yeah.
you have to assess your cardiovascular risk. The concern is that, to my understanding, is that when you give hormones after the 10-year window, if there's already some plaque buildup, you can destabilize that plaque. And so if you are already at high risk for cardiovascular disease, then you have to have a discussion about that. But you can still get benefits from it.
And there's ways we can assess that, right? So we have cardiovascular risk parameters. We can do CT calcium scores. We can do CT angiography if we wanted to. We can refer to cardiology if we feel somebody is super high risk for an assessment. There are many things that we could do to assess a person's cardiac risk. And also in that conversation, we need to be doing what we can to manage those risk factors, right? Is this patient taking aspirin if they're at such high risk? Are they on a statin? Is their blood pressure optimized? What are they eating? Are they sleeping? There are all these other things that we can address aside from their hormones that's going to lengthen their life while we figure out the hormones.
Yeah. Well, thank you so much. Where can people find you?
So I'm online. So my website is www.lifestylesbynoor.com, and I'm on Instagram, Lifestyles by Noor. My practice is in New Hampshire. I also see patients in Maine. I'm working on Vermont. So yeah, would love to see you.
Awesome. Thank you.
Thank you.